Mr. President, I rise to oppose the American Health Care Act. This bill would destroy the Affordable Care Act, even though the Affordable Care Act has given more Americans access to quality, affordable health care than ever before in our history. It would force middle-class families to pay more money for less care. It would leave more people uninsured by a lot. It would allow insurance companies to charge older Americans with what is essentially an age tax, as if our parents and grandparents don't already pay the insurance companies enough for their care. It would cause many working families to lose coverage from their employers, because under this new bill, companies would no longer have to provide their workers with health care. And without a mandate to do so, we know that many of them won't. It would drastically cut Medicaid funding, which would cripple our state budgets, and would leave many seniors in nursing homes and lower-income New York workers stuck without a way to pay for the medical care they actually need to survive. The bill would also take away health care from millions of women, including life-saving health care services like breast exams and pap smears. And on top of all of this, as if to add insult to injury, this so-called health care plan would give a tax break to health insurance CEOs who make more than $500,000 a year. Mr. President, how is any of it, going to make people in my state or your state healthier? I'm struggling to understand why, amid all of the problems we seem to have and all the problems we need to solve in this chamber, why this Congress seems to have a singular fixation on taking away access to health care from some of the most vulnerable people in our communities. I continue to be amazed by how little empathy there seems to be in this chamber for the millions of women, older Americans, lower-income Americans who don't have the incredible resources that we have here in Congress and desperately need the federal programs that this bill will cut. The legislation is completely out of touch with the actual needs of the people in my state, and it's driven by ideology, as if it is somehow the wrong thing to do to help people in our states live healthy and fulfilling lives. If someone is diagnosed with cancer, the only way they can afford to see an oncologist and have surgery is through an Affordable Care Act health plan. Do you think they care whether or not their insurance coverage was made possible by Obamacare? If your parent or grandparent suffers from dementia and the only way they can afford constant care and medical attention is if they sign up for it through Medicaid, do you think they care that Medicaid is a program actually run by the federal government? I don't think families care about that. I think they're much more concerned about whether or not they have access to the insurance plan that actually covers the needs, actually treats their illness, actually gets the medicines they need, and allows them to heal and get back to full strength. That's why the Affordable Care Act has done so many good things for people in our states, because access to health care is a human right. And now millions more Americans finally have it. It's wrong to take it away from them. So I urge my colleagues in this chamber to think much more about the women in their lives who need access to these preventive health care services, to think about all the hardworking Americans who don't earn a lot, though they work full-time jobs and cannot afford it, and think about all of the older Americans who are really being disadvantaged through this bill, so they will not be able to afford that 24/7 or nursing care that they need. This bill harms all of them, and it makes their lives much harder, not easier. I implore all of my colleagues to reject this bill. I yield the floor.